wonderful lives. That's the impact of this. So I can't re-emphasize the need for MIC, okay? The MIC statistics are important indicators of effectiveness of both disease prevention and health promotion services in all communities. Regardless of where you come from, wherever you come from the world, MIC stats represent us as we are in a society. So I think we have the greatest impact for change for the future. So who are these women? Generally speaking, the greatest impact is between ages 25 to 64 years of age. These women are about 50% of our population. It's a pretty big data, right? They're 50% of us, and they count for about 56, almost 60%, 56.7 individuals age 65 and older, and we get more and more as we grow older. 60% of individuals 75 and older, and 67, almost 70% of those 85 years and older. We just live longer, that's what it is, but this population basically is the majority and most of the majority of our world, basically. What are our mortality rates? Well, unfortunately, our mortality rates are really directly connected with chronic diseases currently. And they're associated with our unhealthy behavior. These are lifestyle choices that we make, and they're around really poor lifestyle choices, unfortunately. About 43% of women consume fast foods. Almost 60%, 57% of women consume sugar-sweetened beverages at any given day. These are really terrible stats, but this is the reality of the world we live in. On a positive note, I like to always end on a positive. We're seeing improvements. This is all changing. Women are caring for themselves much better, and thanks to much of what you do, you guide them and you give them the advice they need to get healthier and be reproductive, okay? Some stats, I love stats. I'm a researcher, so I live on this stuff. Leading cause of death among women 18 and older, as you can see the total, if you see the total, heart disease is our leading cause of death, followed by cancer and stroke. Two of these things are really, really lifestyle driven, especially number one, okay? For 18 to 44, unintentional injuries, those are accidents, followed by cancer and then heart disease. For 46 to 64, cancer is leading, followed by heart disease and unintentional injuries, and those are 65 plus, heart disease, cancer, and stroke. This is a self-report of health among women 18 and older. This is how they perceive their health for themselves. When asked for the total excellent and very good health, about 50% of them, 51.4%, feel that they're doing well. This is the best they can be, okay? Those, I believe, they're pretty good. They could do better, but they're pretty good is about 31%. And those that feel that they're not doing so hot, they could do a lot of improvements, they feel fair or poor health, is about 17.5%. There's a lot there, a lot to speak there. There's where we can do a great impact is improving that 17.5 and of course moving that 31.1% into that 51.4%. Everybody should feel that they're at their best at all times. That should be the philosophy. For those that are the youngest age category, these are supposed to be the healthiest, feel like they are, right? So 18 to 34, they're the largest group. I feel good. Oh, well, we kind of know you're young, right? So they're at the 57.3, and of course, those are the older categories. By the time we hit 65 plus, that number reduces to 40%, okay? And, but it's amazing how much impact you guys can have to these numbers. Average number of physically and mentally unhealthy days In the past 30 days, those are the past month, for women 18 and older by race and ethnicity. Those that are physically unhealthy days are in the black. Those that are mentally unhealthy days are in the gray zone. The largest number here, as you can see, are the non-Hispanic American Indians and Alaskan Natives. For all health disparities, for all of these outcomes, they do the worst. Okay, so we can probably, in a public health perspective, do the best for this population. They're at the greatest need. Okay, that's followed up with African American Hispanic groups. Okay, those are the greatest impact that we can give when we're looking at integrative healthcare services for our population. So what are our challenges? We face many. These are just a few. You can't put slides and slides of the challenges we face, but we have a greater use of alcohol, cigarette smoking, illicit drug use. The opioid crisis, as you know, is a major crisis in this country. So potentially improving this women's health, period, really is associated with these variables, and these variables are often, almost always, lifestyle choices. Access to health care. The availability and access to quality healthcare services has a direct impact on one's health. Those checkups, those annual checkups are so important. We won't know if somebody has reproductive health issues until they come to us, right? For you guys, if they don't come to you, how would you know? There's no way to know. So we want that access to be open for them. We want them to be able to go see you, freely be able to go see you and to talk to you and see what's happening with them. Really as in an open market, I want them to be able to access you easily, okay, without boundaries stopping them from accessing you. And of course, those preventive services, before, it becomes a problem for you guys to be able to diagnose and stop the disease from progressing. Because early detection and prevention of disease is a key factor in helping people be healthy and live healthy lives. Okay, and I know almost all of you are reproductive health specialists, so early detection, earlier, for you guys, months, I've heard weeks makes a difference, okay? So the earlier you get in, the earlier you see your practitioner, the better the diagnosis for you. And that's just a given all diseases as well. Okay. The sad part. Adult age 18 and older without health insurance. The total is the black, the dark gray is male, and the female is the lighter gray. As you can see, in all of these age ranges, women have less insurance. Wow. Especially when we're talking about MIC. They're the greatest impact to society. They influence children all the way through adolescence, their health as well as their children's health. But when it comes to access, there's a problem. They don't have it. And so we really have to think about this, that regardless of the age cohorts, women have less access to health. And so we really have to think about that when we design our models for healthcare practices and our policy regarding health insurance. Okay, so health insurance coverage for women age 18 to 64 by ethnicity and race. The total, as you can see, they're mostly by private health insurance, some public, and too much under uninsured, that 19.5, almost 20%. It's way too high, way too high. What numbers I wanted you to take a look at the Hispanic group. They have the largest amount of their population in the uninsured section. That's a problem specifically for our state, for California, since we have such a large Hispanic group. We have to really think about this and how we treat our patients, that they really are the uninsured, followed by the American Indians, Native Alaskans, not surprisingly there, and then of course followed by African Americans. Again, the highest health disparity is within these categories, these three cohorts. Let's talk about what is CAM. My specialty is integrative healthcare practices, but a lot of what I've been doing over the past 10 years is definitional. Why is that important? Definition creates us. It implements us. It puts us where we need to be in a model. So it's extremely important how we define ourselves and our practices, okay? CAM, as defined by the National Institute of Health in 2017, so this is a pretty new definition by them, okay, are the therapies not taught in traditional medical schools, not used to treat disease by conventional biomedicine providers, or those terms alternative. Those therapies that are practiced in conjunction with their conventional biomedicine, it's said to be complementary. That's where we get CAM. The worlds combined, they're our future. The general misunderstanding of CAM by paradigm is that it cannot live in the world of what we call conventional medicine. They're not compatible, okay? That's a misunderstanding, I believe. My research applies that it's not true. Why is it not true? We have an example in osteopathy. Osteopathy comes from the CAM paradigm. So its philosophy is under the philosophy that embeds this inductive holistic paradigm, but it practiced medicine alongside their counterparts, the MDs that are, the opposite paradigm, right? The deductive reductionistic paradigm. So the worlds combined look beautiful. In fact, they take the best of both practices and they reduce their limitations. They gain more than lose. Okay, we'll talk about what that looks like. Hence, we get into the definitions of IM and integrative healthcare. What is IM? Integrative medicine is known as IM. It re-emphasizes that relationship between patient and physician. It integrates, and that's, I think, the most important part, integrates the best